In this episode, I talked to Professor Dr. Rainer Storb, medical doctor, physician and professor, pioneer of the blood stem cell transplantation, and one of the most impactful biomedical scientists and research translators of our time. Rainer is a professor for hematology and oncology at the University of Washington's School of Medicine. He is also a founding member of the Fred Hutch Cancer Center, heading its transplantation biology program and its clinical research division. Rainer is one of the trailblazers who established bone marrow and stem cell transplantation as an effective treatment for diseases like leukemia, lymphoma, and aplastic anemia. As a physician, he has been treating patients with the therapies he himself has discovered, designed, studied, and standardized. We talk about the seemingly hopeless case he and his colleagues took on when he first entered the field in the 1960s.
I mean, everybody who had done and tried transplant had left the field because nothing had worked. There were about 200 published cases and they all died, all the patients, for various reasons.
The adversarial circumstances under which they were conducting their research.
Our University of Washington colleagues considered us idiots. I mean, really, we were outcasts. The West Seattle labs were very primitive. So we had to drive 10 kilometers, and then you descended, I think, 3 sets of stairs to this underground facility in an abandoned World War II bunker.
The challenges they faced, sometimes practical.
Bob Epstein and I did everything ourselves. And then she called us up, like, Rainer, I need some platelets tomorrow afternoon. Are you around? And so we all donated platelets.
Sometimes scientific.
You had to demonstrate, for example, for autologous transplantation that you could store human bone marrow. All of these single steps.
How he dealt with these challenges.
Going back and forth from the clinic, you encountered the problem, and then you said, well, there must be a solution for it. Go back to the laboratory, and then find something and move into the clinic again. But you have to go and see the patients by being attending physician for a month in a row, by being on call, and going through this with the families.
And how first transplantations in humans started to work consistently.
We did exactly what we did in these animals, and started in 1970 with a single patient who unfortunately died of cytomegalovirus infection. But then the next patients were all successful. We still have patients alive from, I think my longest one is from 1971. And he's a retired school principal living in San Diego.
However, not only did Rainer enable stem cell transplantation through these fundamental research breakthroughs, he was also a key figure in maturing the method and translating it to standard procedures for cancer clinics worldwide. We find out how stem cell transplantation evolved into a procedure that has been performed more than 1 million times around the globe since Rainer and his colleagues laid the groundbreaking foundations.
People began sending young doctors to us. It was these people who were then ambassadors.
Over the 50 years to follow, he continued to innovate in the field, establishing various methods to increase the transplantation effectiveness and decrease its adversarial side effects on patients. For example, we learn about how he discovered the graft with leukemia effect.
The marrow was completely infiltrated. We had lymph nodes, and within 6 months after transplantation, his donor cells, the sister actually, had wiped out these tumors.
And how he leveraged it for what would become known as the mini-transplant. After completing his medical doctorate in Freiburg in 1960, performing clinical work in Essen and Munich, and conducting medical research on a NATO Science Fellowship in Paris, he started his work on stem cell transplantation in 1965 on a Fulbright grant in Seattle, Washington.
We traveled by ship, by ocean liner from Bremerhaven to New York. On this ship, there were 700 Fulbright scholars.
And we talk about how Rainer envisions a cancer treatment free of aggressive radiation and heavy chemotherapy on the path to eliminating cancer. I'm certain you'll be fascinated by the story of Professor Dr. Rainer Storb, interviewed by Mohammed Kari.